Good evening, everyone, and thank you so much for tuning into yet another episode of Milk Minutes brought to you by Healthy Start Center for Urban Breastfeeding. Per usual, I am your host, Bianca Suggs. I am the Director of Maternal and Child Health. Brought to you by Healthy Start Center for Urban Breastfeeding. Both per usual, I am your host, Bianca Suggs. Center for Urban Breastfeeding, as well as our Doula program. I'm very excited to be a part of today's episode because we are representing both programs today. We have our special guest, Siriena Stewart, who is our postpartum doula for Healthy Start. Hey, Siriena.
Hey, Bianca. Good evening, everyone. Thank you for having me.
Thank you for joining. So tell us a little bit about yourself.
I am a birth, postpartum, and bereavement doula. I have been doing births for over 16 years. I started with friends and family as an act of love, and then I became trained. I have been with Healthy Starts birth doula program since 2020, and I am now a postpartum doula with Healthy Start as well.
Awesome. So excited to have you. Now, for those of us who are unfamiliar, explain to us what exactly is a doula?
A doula is a trained professional who provides emotional, informational, physical support during pregnancy, birth, and postpartum.
Awesome. Now, what would be some of the benefits that a doula would provide to both a birthing person, a mother, and also her support system?
A doula can be helpful in building trust between the clients and the medical staff. A doula is also having a doula, you're more likely to have a positive birth experience. You're also at a decreased rate of cesareans and length of labor, also medical interventions. Doula supports both the family and the clients. We will help support support the family by making sure that they're doing like techniques, that they know all the information that's provided from the medical team. And also if they need like drinks, snacks, rest, we also help support them in that way as well.
Awesome. Can you speak a little bit to what are some different techniques that a doula would teach a mom throughout her labor experience and also prenatally?
A doula will teach the mom breathing techniques, positive affirmations, ways to self-advocate for themselves, asking questions, making sure that they know that, what's going on if they need a clear explanation.
Now, how would somebody become a doula? Do you have to go to college for this? Any type of schooling? How's that work?
You have to have a training. Usually, the training is about 20 hours long, and then there's a certification process after the training.
Okay, so not too much of an extensive training to get to be a doula.
No, not at all.
Okay. Now you have mentioned both birth doula as well as postpartum doula, and I know that you have served both within the Healthy Start organization. Can you tell us a little bit about both? Right. What are some differences between the two?
All right, so the birth doula provides support during pregnancy and birth. In the role of a birth doula, you are educating the mother before the baby is born, attending prenatal visits. You can help the mom prepare a birth vision and just making sure that they're prepared for the delivery. The postpartum doula is helping for the postpartum period after the baby's born with breastfeeding, self-care techniques, nutrition, educating the mom about different postpartum mood disorders. And I mean, it's just a wide variety, everything from sibling transition, whatever the mom needs, the postpartum doula will assess it and help.
Nice. Okay, so you touched on breastfeeding, and that's what Milk Minutes is obviously highlighting. What ways or what
Yes.
part can a doula play in a mom's breastfeeding journey?
The doula can inform the mother about what's going on with her body, such as engorgement when her milk comes in. The doula can also answer questions, help seek solutions, refer to other programs if needed. Uh, the doula also, before the baby's born, can educate the mom on which pumps will be the best, helping her figure out what will be best suited for her. Also, that's my son. Also, I talk to my clients about like storing because a lot of moms don't know about, storing the milk, how long is a safe time to do that, labeling, the importance of that as well.
Nice. Can you touch on like storing? What are tips that mom should know about storing when it comes to pumping?
I think the tips that I share with my clients are labeling. That's very important to label the milk with the dates. Also, when to freeze the milk. And I also encourage them to label the milk AM or PM for when it's pumped in the morning or in the evening. And also, if the baby's sick, it's good to label that the baby was sick with that milk. And that's important because when the baby is sick again, maybe like a stuffy nose or a fever down the line, it's good to give the baby that milk to help fight off that sickness faster.
Okay. So I guess a lot of moms would probably think that, well, since my baby is sick, I should throw this milk away. But you did say that that milk is still safe to give that baby.
Yes, yes. The body is creating antibodies, so it's like more nutrients in there to help the baby fight the sickness.
So Siriena, what made you become a doula?
I became a doula because it started as an act of love. As I mentioned earlier, I was attending a lot of friends and families' births, which I started doing that because I had a child very young. I was a teen mom, and I seen that there was a lot of like other teen moms that weren't really informed on what was going on. And I was just like so into the pregnancy, reading every book I can find, running home after school to watch the baby story, just wanting to educate myself on what was going on with my body. Um, Also, being a mother of 5 children, each pregnancy was completely different. And I've experienced a lot of different scenarios that I can relate to a lot of moms and give them helpful information and support.
Awesome. And lastly, why would you encourage a mother to get a doula?
I will encourage every mother to get a doula to help have a positive birth experience. Even if you feel like you are educated, you trust your provider and everything, seems to be going well, you just never know what's going to happen. It's always best to be prepared. You never know if your doctor won't be available that day the baby's born, or your partner may be stuck in traffic, and it can be, and a doula can probably make it there before your partner. So it's just always good to have additional support.
Thank you, Siriena.
You're welcome.
So like I mentioned, Siriena is one of our postpartum doulas with Healthy Start. We also offer birth doula services. If this interests you, we strongly encourage that you enroll with our birth doula program. The link can be found in the chat. Also, if you are prenatal or postpartum and need additional breastfeeding education, support, we also encourage you to enroll with the Center for Urban Breastfeeding. Our link can also be found in the chat, as well as our latch line, which is our 24/7 lactation support line, in which you can get in contact with the CLC 24/7, any time of the day, any day a week. That number is also located in the chat. That concludes our episode of Milk Minutes. Thank you so much, Siriena. We are still in the process of celebrating Breastfeeding Awareness Month with Black Breastfeeding Awareness Week starting on Thursday. So we will be also broadcasting another live episode of Milk Minutes next Tuesday, same time, same place, 6 p.m., in which we will be talking to some of our CLCs who help support our latch line. Talk to you then. Thanks,
Right.
Siriena.
You're
Bye,
welcome.
everyone.
Bye, everyone.